All right, well, I do have the top of the hour, so I'm going to go ahead and get started as people are trickling in here. Hello, everyone, and thank you for joining us on today's webinar. Today's topic is patient liability strategies for rural hospital sustainability. This event today is being recorded and as well as qualifying for ACHE credit. The credit survey and a link to where the recordings will be posted will be sent in an email following the completion of this series. So this is webinar 1 in a series of 4. My name is Kale Wozinski, a program coordinator with the National Rural Health Resource Center, which is providing this webinar today. If you want, you can feel free to connect your video feature by selecting the camera icon in the lower left corner of your screen. Your audio is muted by default to avoid background noise and feedback. Please remain muted unless you have a question. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you dialed in, press *6 to unmute your line. You can also communicate through the chat box, which is located in the bottom ribbon in the middle of your screen. If you haven't already, please take a moment to type your name, title, and organization in the chat box so we know who is joining us today. This helps us get a good feel of the audience on the webinar. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. The center is a TA provider for the Delta Region Community Health Systems Development Program. The DRCHSD program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. The center is committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is valued. You may learn more about our commitment on our website. All right, before I introduce today's speaker, I'm going to go ahead and pull up the pre-polling questions. There'll be a set of post-polling questions that we'll host at the end of the webinar today, and it helps us get a good feel of knowledge gained. All right, as you can see, today's speaker is Angie Carmen. Angie is a lead consultant with Healthcare Performance Improvement Team, also known as Forvis. She is a knowledgeable professional with more than a decade of front revenue cycle experience, inclusive of patient access and eligibility services. Throughout her career, she has developed a strong track record of success, training and leading high-performance teams through best practice improvements. As a results-driven consultant, Angie is committed to delivering unmatched client experiences and making a positive impact within the industry. Angie, thank you so much for being here today. I'm going to go ahead and stop sharing my screen. Feel free to take it away.
Awesome. Thank you so much for the introduction, and thanks for, having me here today and taking the time. I'm sure a lot of you are over lunch right now, enjoying this. So hopefully I can make your lunchtime a little bit better. So just a little background again on myself. I do have that hospital background. So I am working in the healthcare performance improvement team within Forvis. I focus mostly on the front and the back, but I do specialize, I would say, in the patient access realm, scheduling, pre-reg, point of service collections, admissions, registration. That's where I've lived for a long time. So as the title says here today, we're going to look at unlocking opportunities for patient liability strategies for rural hospital sustainability. I will say that this can really be applied to not just rural hospitals, but hospitals all over the place. Right. Just a little bit of an agenda here. I've already had my introduction. We'll talk about the learning objectives for my presentation today, and then the patient liability strategy overview, and then we'll have our closing. So here you can see our learning objectives. We have one, what is the importance of patient liability management and what is the impact on the financial resiliency of an organization? We're going to then look at some innovative patient liability strategies and best practices to help support that financial resiliency. And then finally, we're going to look at the effect of patient liability strategy and implementing that and how that is going to impact the overall sustainability and also the patient experience as well. All right, so patient liability management. So the first things we're going to look at are several ways that we can implement this, right? So revenue optimization is the first one. What does revenue optimization mean? So in simple terms, revenue optimization just means to strategically maximize the revenue growth over the long term. So how do we do this? We can do this or how does it do this? How does it optimize revenue? It does it by minimizing unpaid or delayed payments from either payers or patients, and it increases the likelihood of timely and accurate payments from the payer. And it allows hospitals to meet financial obligations and continue providing quality care to their communities. When we look at then financial stability, how does patient liability management support financial stability? Well, it supports accurate and prompt payment collections, and it allows for investment in essential resources, and it maintains quality care, and it sustains operations. So in other words, the faster an organization can get paid, the more readily available that they have that cash ready for immediate use within the organization. As far as bad debt reduction, so the support there would minimize the unpaid or uncollectible patient accounts. It would decrease the financial burden, and it increases then the likelihood of patient payments. So when we look at that, today healthcare is going to be at the bottom of the barrel for patients when it comes to facing their bills. So patients will then tend to delay payments until collections start to call. They're probably going to get upset and frustrated by that. And then in turn, they might also start delaying their care because they don't want to have to be faced with those bills. But if we can discuss those financial responsibility options up front with the patients, we give them more options and more time to make those repayment arrangements, which will then alleviate that headache for them in the long run. And then it reduces the cost to collect associated with bad debt. Oftentimes, when it comes to bad debt, the cost to collect that bad debt actually exceeds the bad debt amount itself, which just results in more lost revenue. And then finally, we'll look at enhanced patient experience. So how does patient liability management support this? Well, it reduces the financial stress on patients and allows more focus on the patient care. So when patients feel less stressed about their medical bills, or when they feel more stress about their medical bills, rather, they're more at risk for delaying needed care, which then could lead to more health issues, which then could lead to heftier bills down the road. It does build trust and support within the community, and it empowers patients to make informed decisions regarding their care and associated expenses. Again, just giving them more power and more empowerment to make those financial decisions in a comfortable way and feel supported and not feel that financial burden. So now we're going to take a look at some patient liability strategies and best practices. So one I do want to touch on that's really, really important is your pre-service payments, or otherwise some people refer to these as point of service collections. So some ways here that we want to strategize is by implementing clear pre-service payment policies and procedures that would then outline payment expectations for patients prior to receiving their healthcare services. But also outline and kind of guide that financial conversation with the team as well. So the staff, they'll have that policy and procedure on how to go ahead and move forward with those conversations in an effective way. You want to offer various payment options and platforms to accommodate different financial situations. So, not everybody's going to be able to just pay the full estimated amount or the copay that might be requested of them up front. If they do voice some concerns, you definitely want to make sure you give them the options, let them know you take, credit cards, health savings account, checks, credit, cash, money orders, but some other options too. Maybe you want to set them up on a payment plan. Or maybe they do need to seek some additional options that fall outside of the payment plans. And you want to give them more platforms to make the payment on as well. So it's really important today is not just having to come in and make the payment call in or mail something in. A lot of patients, including myself, really like the digital options. So having a way to go online and make that payment, or even be able to make it directly from my phone somehow, whether it's through a text message, but giving some different platforms and options for people to make those payments and empower them to have that control. And then finally, communicate the importance of the pre-service payments to patients and provide education on the benefits of paying up front. Again, when they pay up front, it helps alleviate some of that statement work on the back end. And again, you know, it helps to collect that cash faster so that the quality of care, that they can invest in the quality of care more for the patients. Then another aspect of this, best strategies are financial counseling. So training staff to provide a comprehensive financial counseling to patients on whether it's their insurance coverage, payment options, or any financial assistance programs that they might qualify for. You want to develop standardized protocols to support consistency and accuracy. So what does that mean? You want to be able to clearly identify those patient populations, you know, who should automatically get that financial counseling. So your self-pay population is one that I would say always you want to look at. Or do they qualify for Medicaid? Do they qualify for charity? But making sure that you're targeting, you know, that population that doesn't have insurance to make sure that you reduce that self-pay AR and the risk of bad debt there. And help patients navigate financial counselors help patients navigate the complexities of healthcare billing to understand their financial responsibilities and their available resources. So some things, you know, patients, I do also have a background in Medicaid eligibility. I was a senior manager for a company who contracted with different hospitals across the United States for a couple of years. And that was a really big deal, is having somebody available to talk to patients, to let them know, hey, you might qualify for Medicaid disability, or there might be some county or local programs that they qualify for that they didn't even know, or maybe they have a specific health concern or a health diagnosis that now makes them qualified for a certain type of coverage. So it's really important to have somebody help them navigate that as well. All right, and then financial assistance programs, we'll just roll right into that. So you want to establish clear eligibility criteria for financial assistance programs that consider income levels and financial hardships in rural communities. Oftentimes, again, these are set, you know, by the states. You want to look at, you know, the different eligibility criteria, but you want to have it documented in your financial assistance policies on what those income levels are, what those eligibility criteria is, and make sure that the patients are aware of it, and as well as your staff. You want to promote awareness of financial assistance programs. You can do this through community outreach initiatives, presentations and workshops, partnerships with local organizations, educational materials, and online media engagements. I know for one hospital, when we were doing some outreach, we had a fair. So maybe once a month or so, maybe on a Saturday for a certain amount of hours, they would open up a fair to the community to come in, get screened for eligibility, even though they weren't having any services there. They were doing their due diligence to try to get them some coverage. It wasn't in turn for them to come to the hospital. They wouldn't be able to do that, but it was just to really be there and help support the community. And again, another bridge to building trust within the community. And then regularly evaluate the effectiveness of these programs and make adjustments to meet the needs of the community. So, you know, just make sure, you know, are the financial assistance programs that you're using, are they being utilized? Are there some that are on the table that you don't know about? You know, really just making sure that you're looking to see what the community needs, what are they utilizing, and what do they need the most, and really being intentional about helping them. All right, so we have now patient liability, sustainability, and patient experience. So when you're implementing an effective patient liability strategy or management system, It can play a significant role in the sustainability in rural hospitals and again, other hospitals as well. And it ultimately leads to the provision of quality of care for their communities. So how does this do that? So you would look at things like revenue generation, financial stability, enhanced access to care, improved patient care, and community trust and support. So how do these categories help with the sustainability? We're going to go ahead and dig into that a little bit. All right, so when we look at revenue generation, so when you have the timely collection of patient payments does reduce the unpaid and the unpaid bills and the decreases the risk of bad debt. Again, I don't know how many of you are running reports on your AR, but I know that across the hospitals that we work with, they do have a lot of high AR and a lot of it is self-pay. And so there's a lot of risk of bad debt there, especially as it ages. So when you can collect these payments, either effectively up front or quickly, even on the back end, then you're going to reduce those unpaid patient debts. It improves cash flow by minimizing the accounts receivable, as I just said, and it reduces the need for borrowing and relying on outside funding sources. So, hospitals do rely on these payments, to keep their hospitals and organizations up and running. So the last thing they want to have to do is, go outside of the organization looking for additional funds on how they're going to make some operations continue effectively. And then additional revenue can be reinvested to improve patient care, such as upgrading medical equipment or expansion of healthcare services and locations. So again, the more money coming in and the more sustainable that money is on hand, you can go ahead and invest in. If you make upgrades to MRI machines or technology that you need to put you more competitive with the different hospitals around you. Or expand healthcare services that are needed in your area that maybe patients are having to go farther to find this care that they need in different locations. So just expanding things for the community, again, will bring in more patients, more volume, and still more revenue at that point. And financial stability. So again, and it sounds like a lot of this might be repeating, but it bears repeating that timely and accurate billing processes reduce the risk of billing error delays, leading to faster reimbursement. I know that when it comes to patient liability, when billing processes are a little bit broken and there's some errors there, you're going to get that delayed payment. You're going to have to pay extra for the rework. And again, it just is more revenue loss in the long run. Improve financial planning and budgeting, which allows the hospital to allocate resources effectively and make informed decisions impacting patient care, infrastructure, and staffing. Early eligibility determination and application assistance can help reduce the burden of patient liability and increase likelihood of reimbursement. So again, getting in there with the patients who you think are either having a financial hardship, don't have any insurance, or maybe they're just underinsured. So they have insurance, but maybe it's a very high deductible plan like a lot of us have, or it just doesn't cover as much as you would expect. Just getting in there to really determine, what assistance would they qualify for, even if it's just a payment plan and there's no assistance involved. It does help ease that burden on the patient liability, and the patients will go ahead and pay faster, or you'll get reimbursed through another program. And it reduces the exposure to financial risk associated with unpaid bills and uncollectible debt, such as emergency cost-cutting measures and layoffs. So I hope that nobody's experienced that, but I know, and I hope that we don't. I know that people are kind of going through it right now. With inflation, hopefully, there's no more layoffs in the future. But when you think about hospitals not being able to pay their bills, they have to choose between being able to operate or do they have to lay off staff? And especially if the patient volumes are dropping and they don't need as much staff, that's awful as well. So you want to make sure that you're keeping a reason for the patients to come. back to the hospital. But you really don't want to have to go through that. I know that I've been with a hospital system before where we were struggling. And in order to make things work, they did wind up having to get acquired by a bigger hospital system that could help them pay the bills and help them afford things. They had to outsource, right, to different departments to be more effective because they just didn't have the staffing to get there when it came to collections. So these are things that, you want to try to keep as much in-house as possible, and you don't want to risk having to either like an outside source, again, getting absorbed by another hospital association, somebody that can help pay for things that are making more than you. You want to be able to sustain that yourself. Enhanced access to care. So clear communication about patient financial responsibilities and available assistance programs can help patients understand their options, make informed decisions about seeking care. So again, when patients understand that they have options to get things paid for, so they're not going to be stuck with a bill, or they're not going to be stuck not being able to pay for something and not have their health care, I think patients definitely feel more trusting and more apt to put their health care first, understanding that, the financial stuff aside isn't going to be a big deal. We will help with that. We're going to focus on your care. We'll help you find a way to take care of these bills. Leads to increased utilization of healthcare services, supporting better patient outcomes. Again, when patients seek the care that they need without that burden of the financial, then they're going to have better outcomes with their care and their health. They won't suffer, hopefully, long-term from some healthcare issues that should have been addressed and could have been addressed quickly because of the payments that were involved. I know that's very stressful for a lot of people. Improves population health within the rural community. Again, when the community is put first, you're looking to see what you can do to support the community as a whole. It improves the population health all the way across the board. It's like a ripple effect. So improved patient experience. So clear and transparent billing processes allow patients to better manage their healthcare expenses. So that's one thing that, a lot of, from my experience with helping these hospitals, a lot of their policies and procedures supporting patient liability strategy or management are very small or non-existent. So you definitely want to make sure that you have transparent billing processes. You want to make sure that patients understand what those billing processes are. They want to understand what their options are. And they really have to at this point. They really need to understand what those billing processes are, with price transparency coming into play. Flexible payment options and financial assistance programs help reduce stress and anxiety. And early intervention of patient liability support always allows patients to focus on their recovery and well-being. And then community trust and support. So hospitals who demonstrate transparency and a commitment to being a responsible steward of their financial resources, they do build trust within their community. So that can lead to a few things here. It can lead to increased community support through advocacy and donations. So when you have a hospital system who really puts forth the effort to make sure that the community and patients come first, you're going to see more involvement from the community. You're going to see more people wanting to donate their time, resources, whatever it is to take care of their community. They're going to want to do the same thing. Exposure to more volunteer resources opportunities as well kind of goes hand in hand. Having people who want to come volunteer, who want to help their community and do what they can in the hospital source will also kind of ease that revenue, right? You can utilize your volunteers. And positive public reputation increased patient recommendations will ultimately lead to higher patient volumes. So again, more patient volumes, more revenue. but you don't want to lose that revenue. You want to manage it and strategize effectively so that that higher patient volume and that increased revenue works on your benefit. All right, so just to summarize, and I know it's a little short on time, so I apologize, but I just wanted to kind of quickly go through the biggest three things would be the impact, the best practices, and the sustainability. So again, the impact of patient liability management is on the financial stability and that reduced risk exposure, revenue optimization, and improved cash flow. So again, having that cash on hand quickly, and enhance patient experience and increase access to care. When you look at best practices, again, you have your pre-service collections and payment options. You have and again, one thing I didn't really touch on here too is the estimates, pricing estimates within the pre-service collections. This is very high level, but that would be one thing I would actually want to include in there, as well as making sure that when you're having these conversations, the staff is trained on how to have these conversations, that they understand how to talk to a patient about what their benefits mean. What is a copay? What is a deductible? What's your out of pocket? So that they understand it, but also having the tools to run an estimate for a patient for a scheduled service whenever possible, giving them an accurate amount that they would be expecting to pay, which can help you provide them more payment options as well. Early intervention, again, with financial counseling, specifically to, again, that self-pay population, underinsured population that might struggle to pay their bills, or anybody who just might, express a financial hardship. You definitely want to try to get some early intervention in there, get them talking to somebody, and try to get a patient agreement on before the patient has services. And then financial assistance programs, and then promotion and education, again, through that community outreach, and just making sure that you have that conversation with the patient to let them know what options they might have available and what they might qualify for. And then sustainability, investment in enhanced technology and expansion of services. Again, I don't know about you, I like to go to hospitals where I feel like they are more on the cutting edge of technology. They're up to date. They don't have old, outdated equipment. You want to be able to keep up and keep competitive within the community and the surrounding areas. You'll build stronger relationships within the rural community, or any community, therefore, and you'll leads to better patient outcomes and the quality of care of the patients, which again will keep patients coming back as well. And that is my presentation for today. So Caleb, will go to, I guess, questions and go from there.
Sounds good. Thank you so much, Angie. Yes, please feel free, if you have any questions, you can either feel free to come off of mute or enter them in the chat box. While we're waiting for those questions to roll in, if there is any, I'm going to go ahead and pull up those post-polling questions. Like I said, there would be at the start of today's webinar. But yeah, for sure. Again, thank you, Angie, and please feel free to ask any questions you have.
I'm looking. I have some things here in the chat on my end, but I don't know what you can see. These must just be the names of people.
Yep. The names, titles, and organizations from everybody.
And of course, if you don't have any questions or you don't want to ask them on this platform, I can totally understand that. Can always feel free to email me directly. I'm always happy to chat with anybody. If you find me on LinkedIn, can connect with me on LinkedIn, whatever works for you. But I always enjoy having these conversations and helping answer any questions I can.
That sounds good. Well, if there aren't any questions, feel free to fill out those post-polling questions and take off for the day. Get 30 minutes back in your day. Go have a great lunch or do something productive. Get outside, go look at the sun.
Sounds good. Thank you all so much. Thank you, Caleb.
Thank you. Thank you for being here, everybody. Thank you, Angie, for presenting. We'll see you next week when we take on session 2.